Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. Downloadable slides and resources are also available. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
This activity includes discussion of therapeutic products that have not been approved by the U.S. Food and Drug Administration, off-label uses of approved products, or data that were presented in abstract form. These data should be considered preliminary until published in a peer-reviewed journal. Readers should verify all information and data before treating patients or employing any therapies described in this or any educational activity. A qualified healthcare professional should be consulted before using any therapeutic product discussed herein.
The following presentation is part of a certified educational activity provided by Medscape Education and supported by an independent educational grant from Jazz Pharmaceuticals, Inc.
Hello, Veronica. How are you doing today?
Hello, Dr. Rogers. I'm doing all right, thank you.
I see you were referred to me by your neurologist, Dr. Whitworth, because he was concerned about your blood pressure?
That's right. He thought it was a little too high for a person my age.
Yes, it says here that your last home measurement was 130/84.
Yes, that's right.
Indeed. It's not astronomically high, but it is a little elevated.
I agree.
And we also did some tests to look at your ambulatory blood pressure, or your blood pressure over the course of a day and your blood pressure at night while you were asleep, while wearing a device that took frequent measurements. How did that go?
It took some getting used to, especially when I went to bed that night, but it worked out okay, I think.
Yes, we were able to get some good measurements. One thing I'm concerned about that I would like to discuss with you is that your blood pressure didn't decrease as much as we would expect at night, what we call non-dipping.
I see. So my blood pressure stayed high even when I was sleeping?
Yes, that's correct.
What does that mean in terms of my health exactly?
When we go to sleep, we experience a natural dip in blood pressure, which helps maintain our heart health. So if this dip doesn't happen, or if it is blunted, it can have an impact on our cardiovascular system. For example, narcolepsy may also be linked to other cardiovascular issues like increased cholesterol levels or hypertension. Also, the medication you're taking for your narcolepsy can have an impact on your cardiovascular measures too.
I see. I didn't know that having narcolepsy could have an effect on other health issues like that. Though now that I think about it, it seems to make sense.
And that's one of the reasons your neurologist referred you to me.
But what can I do to help decrease my blood pressure? Would I need to take another medication or?
No, not necessarily. There are a number of things you could try that I think would work very well. Would you like to discuss those now?
Yes, please.
Hello, this is Viren Summers. I'm a cardiologist at the Mayo Clinic in Rochester. I have a very strong interest in sleep and sleep disorders and how sleep, disrupted and normal, relate to cardiovascular health and cardiovascular disease. Narcolepsy affects about 1 in 2,000 people worldwide. It's a chronic disorder, the features of which include excessive daytime sleepiness, which I will refer to going forward as EDS, disturbed nighttime sleep, REM dysregulation, hypnagogic and hypnopompic hallucinations, sleep paralysis, shortened sleep latency, and shortened time to enter REM, and patients may or may not have cataplexy. If they have cataplexy, it's called narcolepsy type 1. If there's no cataplexy, then it's narcolepsy type 2. Beyond the core symptoms, narcolepsy is associated with a range of comorbidities that can significantly impact health and quality of life. These include psychiatric comorbidities like depression, anxiety disorders, and ADHD or attention difficulties. Sleep-related comorbidities include sleep apnea and REM sleep behavior disorder, Cognitive and functional impacts include memory and attention deficits and defects in social or occupational functioning. Metabolic and cardiovascular comorbidities include obesity, type 2 diabetes and insulin resistance, hypertension, and other cardiovascular risks, which are possibly related to sleep fragmentation and metabolic dysregulation.
I'd like to talk with you about some other things we could consider, Veronica, that might have a positive impact on your blood pressure.
Of course, I would appreciate that.
There's a program from the American Heart Association called Life's Essential 8. Have you heard of it before?
No, I haven't.
Life's Essential 8 is basically a checklist for lifelong good health, and it has 8 suggestions for improved heart health, focusing on health behaviors and health factors. I think this would be a great place to begin thinking about what lifestyle improvements we can make to help lower your blood pressure.
That sounds great. Which of the suggestions would be the best for me, do you think?
I think we could consider recommendations like being more active and eating a healthy diet to start. You are not a smoker, right?
Yes, that's correct.
Excellent. Other factors we could consider include managing weight and cholesterol levels, as well as blood sugar.
Okay, that sounds promising. But would I have to do something different to address each of those factors? Altogether, it sounds a little overwhelming.
I understand. And we can go one step at a time, of course. But the good news is that these factors can all be addressed starting with small adjustments. Once you take the first step, we can consider taking further steps to improve your heart health. Don't worry, you wouldn't have to make any drastic changes right away.
Can we talk about ways I could be more active? I've been putting off exercise because I'm not sure what is safe for me to do with narcolepsy. I wouldn't want to get hurt if I have a sudden episode.
I absolutely understand. And there are some considerations we can discuss. For example, you could try swimming with a group or with friends. Walking or aerobic exercise would be fine, and resistance training with weights would also be a great idea, as long as you do all of these with a group or with a friend.
I hadn't thought about that, but it sounds like a good idea. Having other people around would help me feel safer. Plus, always going with a friend would help keep me motivated on days where I might not feel like moving much.
Yes, friends are indeed great for motivation.
And I've been trying to eat better already. I've been trying to add more fruits and vegetables to my meals lately, as well as cut down on salt.
So you're already on the right track. Keep doing what you're doing and perhaps add some movement, and we'll see how it goes.
Okay, I think I can handle that.
Let's make a plan to see each other again in 6 months, okay? Then we can look to see if there are any improvements in your blood pressure, cholesterol, and blood sugar.
Yes, of course. Thank you.
You're very welcome.
Preclinical studies suggest that the hypocretin neurons involved in sleep and wake modulation are deficient in narcolepsy and may increase sympathetic activity, heart rate, and blood pressure. Although the underlying mechanisms for cardiovascular risk are not yet defined, increased nighttime blood pressures, increased circulating inflammatory leukocytes, and a greater susceptibility to atherosclerosis may be implicated. Narcolepsy is associated with comorbidities that increase cardiovascular risk, including obesity, diabetes, and depression. In addition, there is a marked increased prevalence of precocious puberty in children with narcolepsy type 1 compared with controls. Precocious puberty is known to be associated with a higher risk of cardiovascular disease and mortality in adulthood. People with narcolepsy are at higher risk for comorbid obstructive sleep apnea and periodic leg movements during sleep, which are also each associated with a higher risk of cardiovascular disease, hypertension, and possibly mortality. Disrupted nighttime sleep and EDS are cardinal features of narcolepsy and may themselves individually contribute to cardiovascular risk. Wake-promoting agents such as modafinil may be associated with a higher use of antihypertensive medications. Solriamfetol was associated with small increases in heart rate and blood pressure, and the concurrent use of modafinil and solriamfetol is contraindicated in patients with unstable cardiovascular disease, serious heart arrhythmias, and other significant cardiac problems. Pitolisant is a histamine 3 receptor antagonist or inverse agonist that is indicated for the treatment of EDS or cataplexy in adult patients with narcolepsy and has been associated with slight QT prolongation. Methylphenidate is associated with increased blood pressure, faster heart rates, and cardiac arrhythmias. Now, many antidepressant drugs, which are prescribed off label for the treatment of cataplexy and narcolepsy, may also have potential cardiovascular safety concerns, including clomipramine, venlafaxine, and protriptyline. Clomipramine is associated with a decrease in orthostatic blood pressure, faster heart rate, and ECG abnormalities. Venlafaxine associated with increased blood pressures, and protriptyline with heart attacks, stroke, heart block, arrhythmias, hypotension, hypertension, faster heart rates, palpitations, and weight gain. Now, sodium oxybate is indicated in the United States for treatment of EDS or cataplexy in patients 7 years of age and older with narcolepsy. Importantly, patients taking sodium oxybate ingest up to 1,640 milligrams sodium nightly, in addition to their dietary sodium. And sodium intake may increase blood pressure as well as increase the risk for cardiovascular events, particularly stroke, independent of baseline blood pressure in the general population. A lower sodium oxybate is now approved and should circumvent any concerns regarding a greater intake of salt. When monitoring patients with narcolepsy for cardiovascular and cardiometabolic risk, one should annually monitor blood pressure, weight, and waist circumference, be sure to assess for obstructive sleep apnea, implement guideline recommendations for screening lipids and hemoglobin A1C, and in patients with hypertension, a family history of premature cardiovascular disease, diabetes, glucose intolerance, obesity, metabolic syndrome, and sleep apnea, consider initiating earlier or more frequent monitoring as clinically indicated. Annual monitoring of modifiable risk factors such as smoking, exercise, diet, blood pressure, lipids should also be taken into consideration.
Hello, Veronica. Welcome back. How are you doing?
Very well. Thank you, Dr. Rogers.
Indeed. We have the results of the blood test you did before your appointment, and everything is looking promising. All of your values show some improvement, including your blood sugar, A1C level, triglycerides, HDL and LDL cholesterol, and non-HDL cholesterol. All of this is good news for your heart health. And you've been measuring your blood pressure at home, right?
Yes, I have. My last measurement this morning showed that I was at 125/81.
That is very good, Veronica. I'm glad the changes you've made seem to be working.
Me too. I've really been doing my best to eat healthier, and I've started taking swimming classes with my friend Emily. Plus, I go to the gym with another friend at least twice a week to do some aerobics and weight training.
That's a great attitude to have. And we can see the results of your hard work already. Your weight has decreased by 10 pounds and your BMI has dropped by 1 point. You are doing really well. How do you feel? Are these adjustments doable with the narcolepsy?
In the beginning, it was a little hard, I have to admit, especially with exercising. I was really nervous something was going to go wrong. But after I got used to everything, I started to enjoy it more. And it really does help to be in a group or go with a friend. And I feel great too.
That's very good, Veronica. And if you can, you should keep doing what you're doing.
I can do that. I was a little skeptical in the beginning, but I see now how making a few small changes can have a really big impact. May I ask a question though?
Of course, please.
How long will I need to keep doing what I'm doing now that things have improved? Please don't misunderstand. I really enjoy exercising and eating well and the time I get to spend with friends, but I also sometimes wonder if continuing to do these things indefinitely is realistic.
Well, there are a few things to consider, Veronica. From the standpoint of your narcolepsy and cardiovascular health, it is always advisable to continue to eat healthy and to get plenty of exercise. But I also understand where you're coming from. You may have moments when you have less time to devote to exercise and healthy eating, and that's okay. We can always meet again and discuss how to make adjustments so that you can still stay healthy and fit everything into your schedule. But since narcolepsy is a lifelong condition, a healthy lifestyle will always be a good idea.
Yes, I understand that. And I appreciate that we can discuss any changes that might need to be made later on. That's reassuring.
Of course. Do you have any other questions for me today?
Not right now. I'm glad things seem to be improving, and thank you so much for the good advice.
It is my pleasure, Veronica.
Sleep is a foundational element of human biology and a requirement for life. Sleep health is a multidimensional construct with overlapping components, including duration, timing, regularity, efficiency, satisfaction, and impact on daytime alertness. Life's essential aids are the key measures for improving and maintaining cardiovascular health, as defined by the American Heart Association, with the objective of overall lowering the risk for heart disease, stroke, and other major health problems. The key points are to eat better, aim for an overall healthy eating pattern that includes whole foods, lots of fruits and vegetables, lean protein, nuts, seeds, and cooking in non tropical oils such as olive and canola. Be more active. Adults should get 2.5 hours of moderate or 75 minutes of vigorous physical activity per week. Cardiopulmonary fitness is inversely related to daytime sleepiness and frequency of cataplexy, suggesting that exercise and consequent increased fitness may enable people with narcolepsy to have decreased sleepiness during the daytime and potentially also decrease their frequency of cataplexy. Good sport options will include walking or jogging, yoga and stretching, weight training, swimming, and water aerobics. Although for individuals with cataplexy, water activities and other activities that may pose dangers with falling will require extra safety precautions, such as always having a partner and, when in water, wearing a life preserver. A caveat in terms of physical activity is to know that sleep is improved by a decrease in body temperature, while an increase in body temperature prolongs sleep onset. Exercise results in increase in body temperature and so, if performed immediately prior to bedtime, may result in prolongation of sleep onset. This may help explain why high intensity exercise in the hour prior to bedtime may have a negative impact on sleep quality. So choose the appropriate time for practicing sports or physical activity. Other key points: quit tobacco or don't start, manage your weight, control cholesterol, manage blood sugar, and manage blood pressure. Remember that narcolepsy is a chronic, lifelong neurologic sleep disorder that requires ongoing management beyond pharmacologic treatment. Because symptoms such as excessive daytime sleepiness and disrupted nighttime sleep persist over time, patients benefit from adopting and maintaining lifelong healthy lifestyle habits to support overall well being. Clinicians should emphasize the importance of sustained lifestyle strategies combined with appropriate medical therapy to improve daytime alertness, enhance quality of life, and reduce long term health risks. Thank you very much for participating in this program.